Medicare for All bill unveiled by Democrats. It has more than 100 co-sponsors, and though Democrats have not released a price tag for their measure, American Action Forum estimates it will cost $36 trillion over 10 years. That is, by the way, about the cost of our entire federal budget. Let's bring in Louisiana Republican Senator, medical doctor Bill Cassidy, who also happens to have a plan of his own. Senator, you know, listening to Ms. Dingell talk about how it works great in England, why not here? I've spent a time in English hospitals. I was forced to for about a month. They're horrible. They have a lot of penicillin-resistant diseases going around. Their equipment is falling apart. They don't have access to the drugs that we have. I'm worried as much about the cost of this as I am about what happens to the quality of our health care if we go socialized.
Yeah, so let's make a couple of points, David. First, let's welcome those 100 Democrats to the Repeal Obamacare caucus. It's taken them 9 years, but they now realize that Obamacare does not work. As one person tells me, it only works if you don't. So that's number one. Number two, $32 trillion. Putting these people into a health care system, Medicare, which is already going bankrupt in 10 years. Medicare for all means Medicare for none. And what they're not saying is they're taking the employer-sponsored insurance that 150 million Americans have and that they like, they are forcing them out of it and putting them into Medicare, again, a plan going bankrupt in 10 years. I'll finish by saying, whereas Republicans want the patient to have the power, it appears that Democrats want government to have power over the patient. That's not where I am.
Senator Cassidy, this is Gary Kaltbaum. Look, I'm a big believer this is not just about health care. This is just about taking over everything in the economy. They're trying to do it with energy also. Are you going to use, I know you mentioned 150 million people, but that's actually 91% of all people already have insurance. They're whining, complaining about 9%. Are you going to address that in your messaging as we move forward, that 91% already have insurance?
Absolutely. They are being so incredibly dishonest. They're not talking about cost. They're not talking about the fact that you'd have to double your individual tax rate, double your corporate tax rate. In Bernie Sanders' plan, they cut providers by 40%. You're the nurse, your salary just went down by 40%. They are not telling people that when they promise them Medicare for all. Let's be honest. And let's also again say that 150 million people have their employer-sponsored insurance, which they like, and now they're going to lose it because they're forcefully taking it from them.
Senator, it's Liz Peek. I really applaud you bringing out a program because it's not easy to fight a big thing like Medicare for all with nothing. Republicans have to have something they can counter with because the American people really are very concerned about health care costs. I like the fact that you're talking about the cost of health care going down, not just insurance premiums. All we've done for a decade is talk about insurance. So the question is, how can you kind of encapsulate this in a sort of easy slogan, if you will, or an easy to sort of think about program that catches the imagination as Medicare for All has?
Wouldn't it be incredible if you gave the patient the power? The power of knowing the price of a procedure before she had it done, as opposed to 6 weeks later when she gets this incredible bill. The power to know that if she goes to an in-network hospital, she's not going to pay out-of-network charges. The power to have drug pricing in a transparent way, as opposed to being done in a backdoor way, in which she's merely the excuse for a price she has no control over. No, she is actually the purpose of it, and there's some rationale as to that price. We're going to give the patient the power.
Senator, this is Jonathan Ortegas. At the President's State of the Union, he actually referenced prescription drugs. He was a little bit vague, but it was clear that that's something, instead of repealing and replacing Obamacare in 19, that he was going to focus perhaps on prescription drugs. What do you think about the President's proposal, and do you think can it get through the House and the Senate? Do we have any realistic chance here of getting anything done?
Some of what he is doing is going to be done strictly through Medicare and Medicaid, or through Medicare by his administration. If you outlaw rebates in January of 2020, that is the proposal, and if rebates account for about 40% of the list price, that means a patient going to buy her medication with cash gets a 40% discount. That is remarkable. That is substantial. And most likely the commercial space will follow what Medicare does. If not, hopefully we can get bipartisan support for a bill which reflects the administration's effort.
Senator Jonathan Hoenig, thank you for being with us. The Democrats believe that health care is a right. Do you believe that health care is a right? And if it's not, what is it?
Functionally, we've made health care a right. If, Jonathan, if you're in a car wreck and they can't find your insurance card, you're brought to the hospital, you get those services that you need. And by the way...
So you agree, sir?
I agree that
health care is a right.
We have functionally made health care a right. And by the way, my medical practice for 25 years was caring for the uninsured. So not only do I recognize that society has functionally made it a right, but I've lived my life trying to give health care to other people.
Dr. Senator Bill Cassidy, great to see you, sir. Thank you for joining us. Come back and let us know how it's going, okay?
Thank you, David.
Appreciate it. Well, if you could...